A recent study by the Center for Connected Health reported that text messages are extremely helpful when trying to get patients to do the right thing. I'm sitting here now with Dr. Joe Kvedar, who is medical director for the center. Thank you so much for being with us.
Great to be with you.
Well, it looks like we are heading in the direction where technology is going to be indispensable when getting that information out to people who need it. Is that correct?
Yes, that's absolutely true. The idea of using mobile phone text messaging, which is simple, scalable, easy to use, and can deliver very, very targeted, personalized messages to patients. In our experience, it makes them feel more connected to their providers, and 201, they say they're more engaged with their health and more adherent to their care programs.
Right, and this survey specifically looked at skin diseases, and people were able to use their creams more efficiently, more timely, because they were reminded to do so.
Yeah, this particular one was on atopic dermatitis, which is a very uncomfortable skin condition, lots of itching, and yet we know that baseline patients probably do what we ask them to do for that condition about 25% of the time for a variety of reasons. And in this program, they all reported that they were much more likely to stick to their care regimen more faithfully, and they felt better as well.
Is there a specific type of patient that is going to be more open to using this technology than another type of patient?
Well, it's interesting. Of course, the first thing people always gravitate to is age. And yes, only about 25% of seniors are sending and receiving texts, and my youngest daughter, who's 16, thinks voice calls are quaint. So that's the difference in age range, but it also cuts by chronic illness. Individuals with 2 or more chronic illnesses are less likely to use technology. So texting has become really helpful for things like mental health, pregnancy and prenatal care, and the kinds of things we did with applying your sunscreen or advising someone to take their medication for a chronic illness.
How else is the center going to use these technologies going forward? We're hearing a lot about electronic medical records and really having more contact via electronic means. So what is the center doing specifically?
Well, our work focuses on the notion that if we can measure something objectively about you, we can help you gain insight into how that measurement is affected by your lifestyle and keep your health care more top of mind. So blood pressure is a good example, or your activity level as measured by step counts. Those are all things that we can now measure wirelessly very easily about you, and then give you that feedback by way of either your mobile phone or a website, where you can put into context how your daily life affects your health or your chronic illness and improve your care to that degree. For instance, we looked at a group of people on a blood pressure monitoring program in a controlled trial, and we found that if we were able to get them to measure their pressure 3 times a week and look at a website with their results once a week, they did significantly better in terms of their clinical outcomes than a group of control patients.
And also, are they more engaged in the process?
Much more engaged. These people had twice as many medication changes, so we knew that they were taking the information to their doctor and having a conversation about their blood pressure and whether they're on the right medicine or not. So really powerful to get patients engaged in taking charge of their own health. That's one of the major focuses of our center.
What type of investment would other centers that aren't already on this track need to be thinking about if they'd like to go and do what you guys have done at the center?
Well, we have 15 years of experience, so we've built a platform to do this in a way that is very powerful and links to our electronic record and takes data in from a variety of sources. So I don't know that I would recommend that people go off and start from scratch to try to reproduce that. We are able to help individuals get their products into the marketplace and place their products. We do offer that kind of help to both companies and health systems. But I think the main thing these days is really about the change in payment structure from fee-for-service to bundled payments. And as we see that, healthcare systems are having to think more about how they work efficiently and use their brick and mortar more efficiently. Connected health enables you to keep populations of individuals healthy in their home and in the workplace, and only bring them in for a visit when it's really critical that you need to see them. So you can really use your buildings more efficiently, spread your care knowledge base out amongst a larger population, and we've shown time and again that that improves outcomes and reduces costs.
All right, very interesting. Thank you so much, Dr.
Great pleasure to be
Kvedar.
with you.
I'm Mabel Jong. You're watching continuing coverage of the World Healthcare Congress in Washington, D.C.